place that you have here. I didn't expect it to go like this, but now that we're here, I was just curious, Rama, when we spoke in our previous meeting, you had kind of mentioned how you've already inculcated a lot of technology in Tribal Health Initiative, and how you've uh, been developing softwares, websites, apps, etc. Whatever is minimalistic, you've still been doing it on your own. So, just wanting to understand where that came from, and why do you think technology is as important as it is right now? Has it always helped you, or how has the journey been?
Yeah, I personally believe that technology is a tool which we should use. Right? I don't think you should ignore it. Why we got into technology is because there was nobody to help us. We were in a very isolated position. So out of necessity, we had to learn to do this. For example, hospital software, these things and all, and we were too poor to go and purchase hospital software. Therefore, we bought books and learnt and started doing it. I think in the future also, uh, technology is definitely going to help us do our work better. But I feel that we should have a certain, we should also learn along with the technology providers so that without asking them, we will be able to do modifications on our own. I think that is very necessary for all NGOs for that matter.
Right. So, how do you think your work, especially, has improvised after you've introduced technology into your internal operations? How much has the work changed, or how big of an impact has that created, including technology in your daily operational works?
See, from the hospital, what I can say is that see, we have got data from 1997 onwards when we started this, and it helps us to analyze this whole data because if it was on paper, it would have been very difficult to analyze. And because we had it electronically, we had reports from every year, which meant that researchers could come and analyze the data, and we ourselves could analyze the data about where we were going and what our infant mortality rates or our surgical infection rates were. Recently, because of AI, it has been also helping us to develop some small apps, which we are learning, but we consciously start learning also and start doing it, making mistakes, but that's okay, I think, and that helps us there. There is some deficiencies because, for example, websites and things, we know how to modify it, but how to make a beautiful website is beyond our this thing because that needs some amount of artistic capability as well as some technological capability. But we have a website; it's not very beautiful, but we are able to get inside and also modify these things, add photos, add reports, add things.
Awesome. Thank you.
Thank
Correct.
you.